Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. President Muhammadu Buhari approves additional 8.9 billion naira for payments to health workers. Oyo and Rivers states take advantage of coronavirus pandemic to improve on health facilities in their states. Adamawa state government takes COVID-19 sensitization to rural communities to curb the spread. And Israel considers a nationwide lockdown as the country experiences a new daily record in cases. More than 900,000 deaths have been recorded around the world due to COVID-19. Latin America and the Caribbean are the worst hit region, accounting for over 300,000 deaths, followed by Europe with over 200,000 fatalities. In Nigeria, Lagos has recorded the highest deaths at 203, followed by Edo 100. The FCT in third place with 70 deaths. Rivers is fourth, recording almost 60. In fifth place is Kano, which has recorded 54 deaths from COVID-19. In the last 24 hours, 276 people have recovered from the virus and were discharged. This was reported in 10 states, plus the Federal Capital Territory. Figures from the Nigeria Center for Disease Control shows that the FCT topped the list of daily COVID-19 cases with 40 new infections. A total of 176 cases were confirmed in 16 states and 3 deaths were recorded, 1 each in the FCT, Ogun and Rivers states. Till date, total figures are now 55,632. 43,610 cases have been discharged and 1,070 deaths recorded across the country. According to the Africa Center for Disease Control and Prevention, the COVID-19 virus can be transmitted in areas with hot and humid climate. Now, only persons who test negative to COVID-19 will be allowed to fly into the country. The chairman of the Presidential Task Force on COVID-19, Mr. Boss Mustafa, reiterated the protocols guiding travelers into Nigeria, stressing on the need for pre-boarding testing, with travelers advised to visit and register their information before any trip. While apologizing for the hitches the intending travelers experienced trying to pay online for their COVID-19 tests, Mr. Mustafa also announced that an additional sum of 8.9 billion naira has been approved by the president as funds for hazard allowances for health workers.
I wish to reiterate that all travelers arriving in Nigeria must have tested negative for COVID-19 by PCR in country of departure, pre-boarding, and the PCR test must have been done within 72 to 96 hours before departure. It is also important to note that passengers are required to remain in self-isolation upon arrival and undergo a mandatory COVID-19 test in a designated private laboratory by the 7th day after arrival. The Presidential Task Force is aware of and working with other partners to speedily resolve the teething challenges faced by intending travelers in accessing the portal, the cost of the test on arrival, inability to complete payment online, and consequential inability to board. We therefore apologize to everyone that had experienced these challenges using the platform. We assure all Nigerians and visitors to Nigeria that the PTF is working across multi-layer stakeholder platforms to ease the bottleneck. Over the past 1 week, a lot of discussion in the public space has happened around the strike action by doctors and threat by other unions in the health sector. While appreciable progress has been made in the negotiations to resolve the issues, I must underscore the fact that we are in a global public health emergency situation that has impacted negatively on all aspects of our lives, including the economy and finances of government. This has made it imperative for all citizens, irrespective of their professions, and particularly health workers, to reawaken the sense of humanity and patriotism. The health survival of our dear nation is important, and we should eschew any action that will diminish the gains made in the containment of the pandemic so far. I'm pleased to announce that Mr. President has graciously approved additional 8.9 billion naira for COVID-19 hazard allowance to all medical and health workers in the country. In addition, the procurement of personal protective equipment, PPE, for hospitals and isolation centers is in progress and will be given priority.
Staying with the briefing, the Independent National Electoral Commission says it has developed a policy covering electoral activities in Nigeria during the pandemic. According to the chairman of the commission, Professor Mahmood Yakubu, 8 protective measures have been developed to ensure that elections are free, fair, credible, and in line with the COVID-19 guidelines, safe. He said the forthcoming elections is coming in an age of voting that has never been seen before.
It is mandatory for every voter to wear the face mask or face covering, without which the voter will not be allowed to vote. We need to emphasize that we are not asking for the kind of face mask I'm wearing, not surgical face mask, but face covering. Face covering will be sufficient for the voter to be accredited and to vote. Voters must avoid touching surfaces or leaning on walls at polling units. Furthermore, we also have clear protocols for dealing with voters who show symptoms such as high temperature, cough, sneezing, etc. In this case, they must obey all directions by officials to stop other voters from getting infected.
As part of efforts at mitigating community spread of COVID-19 and other diseases affecting communities, the Adamawa state government has commenced the recruitment of over 1,000 technical health workers in the state. This recruitment exercise, according to the chairman of the Adamawa State Primary Healthcare Development Agency, has become necessary because of the need to provide healthcare to the doorsteps of the people.
Call it a major strategic move aimed at curbing the spread of COVID-19, and you may not be wrong. The idea of healthcare delivery to the ordinary people at the rural communities is a big priority for the Adamawa state government, and it says it's determined to make this work. As a first step, the state is recruiting thousands of healthcare workers to fill in the existing positions in the rural areas where community transmission of COVID-19 has become a big threat.
Obviously, there are evidence of community transmission. We have cases which we cannot identify their source or how they contracted the infection. So at community level here, because of our spread reach and in view of the existing structure or the platform that we have at communities, in every of our facility, we have a facility management within the facility comprising of technical health workers, and they interface with the community.
At the headquarters of the Adamawa State Primary Healthcare Development Agency in Yola, the state capital, hundreds of healthcare workers turn out for the recruitment exercise. The senior special assistant to the Adamawa State Governor on Primary Healthcare Services says it's a strategy towards increasing the availability of the workforce in health facilities across the state.
Most of our staffs in the past have been ad hoc staffs of either one NGO or the other. So now these are the time that these people are winding down the services. And you can see that we're in a global COVID pandemic where our health system are being challenged. So now we're in a situation that we need to own up to our responsibilities. We have over 1,000 primary healthcare services, but right now we have just about 403 who are working within the states. And we're trying to break them down to 226. We're prioritizing quality against quantity.
A community leader in an area affected by insurgency describes the recruitment as a good development.
The governor and his team are doing well in controlling the COVID-19 spread. And by employing these workers also, it will go a long way.
According to the chairman of the Adamawa State Primary Healthcare Development Agency, the workers will be distributed equally across the 21 local government areas of the state to help in the fight against COVID-19 and take care of other health needs of the people.
Joining us via Skype right now is Dr. Ugonnaya Igwilo. She's a public health physician. Thank you for joining us on the program.
Thank you for having me.
All right. I'd like to begin with some of the highlights of the Presidential Task Force briefing today, and that is, the release of funds for health workers, 8.9 billion naira. There's also the PCR test, 96 hours, mandatory tests for COVID-19 before taking that, before arrival, taking that trip. And we heard from the INEC chairman as regards every voter, everyone wearing a face mask, and it could just only be a face covering.
So, thank you again for having me. So far, from what we've seen that the Presidential Task Force are taking measures to both communicate to the public, put in place. Hello? Can you hear me?
Yes, go right ahead.
Okay. And so they've been taking measures to put in place all these, first of all, by producing guidelines, like what the NCDC is doing, and also, bringing up both of course, with the opening of economies, they talked about the international travel. They are at least talking about resolving the Johesu and the NARD strike issue. So it shows that at least the government is they are really interested in protecting the Nigerian community against this pandemic. So these are important measures they are taking. First of all, by producing policies around the elections, making sure that, yes, people have to wear face coverings, they have to have wash facilities in place, and of course, producing guidelines in terms of, we are now opening up the economy. You have to do this mandatory testing. So they are trying to protect the Nigerian community. At the same time, protect other communities outside the country from having spikes or increase in their own rates of infection. And that really goes a long way to at least to show how committed, at least, they are to curbing this pandemic and hopefully reducing it and stopping it.
But Dr. Igwilo, some experts have criticized their efforts, being that they're saying there is a dearth of testing, for example, and on the other hand, we're recording this lower numbers. And then you have an economy that is opening up international travel, schools. So isn't there perhaps a case of mixed messaging in the public health response?
So remember that this pandemic in itself upended both the economic, the social, and of course, the health aspects of nations. Now, even if, for example, the truth is that, like what the minister said, we cannot lock up the economy for so long, because remember that there are also repercussions from locking down the economy, from children not starting school, from not starting up international travel, because remember we also need to generate our own revenue. So it's not really per se about mixed messaging. It's more about the steps that the country is taking to protect the vulnerable. Because remember that we have a lot of daily earners. In fact, we have a large proportion of our citizenry being daily earners. So by opening up the economy, you're bringing in revenue for them, you're protecting their families from poverty, and of course, at the same time, they're going to they will have enough income to put their children back in school. So everything is still tight. These are important measures. And they are not just opening up the economy. If you've noticed, they are also putting in place measures. They are producing policies, producing guidelines in tune with the opening up they are doing. So they're not just relaxing. For example, with the international travel, they are saying, you have to have this test done prior to coming in or before you go out. Oh, you have to do, and of course, with the airport, there's the physical distancing, there's ensuring that there are wash facilities everywhere. So at the same time, they are protecting both the economy of the nation and of course, there are people at the same time trying to protect against the pandemic. So it's important that, and you can see that they're communicating. They've been saying this to their people over and over, that's the Nigerian people over and over again, so that they understand why this is important, why they need to, why children need to go back to school, the devastating consequences it can have on their education, and of course the economy as well.
All right, thank you for contributing to this important issue. Dr. Gunnar Aguilo, public health physician, thank you for joining us.
Thank you for having me.
In the wake of the realities occasioned by the coronavirus pandemic, the River State Governor, Nyesom Wike, has inaugurated an implementation committee to make recommendations on how to revamp some of the healthcare facilities in the state. The committee is to be chaired by the Deputy Governor of River State and has 1 month to submit their report in order to guide the government on the needed upgrade and terms of agreement in running the facilities.
What I want is accurate, not we think. Not we think. No, you must get accurate, because what it will take to bring back that Kelsey Harrison hospital, so it can be put to use for the services of our people. It's very key. And then the dental maxillofacial hospital too, so that we'll move away from these two porta cabin. In fact, it was yesterday I heard from this report that we are using a porta cabin for dental, so it is very, very embarrassing. Very, very embarrassing. So now we have an opportunity. I don't even know why a state should have that and then give it out to private people, and then their students or the medical, the dentists cannot train, they cannot train their dentists. It's very, very bad, you know. So please, I don't want bureaucracy now. I want you to go into action, and within 1 month, submit your report.
We are going to work within the time you have given us, the time frame of 1 month. If we have to stay a week, we will all stay a week and do it. Whatever legal issues, we know that our legal team can take care of that. But meanwhile, we are going to put in place those things that will revitalize these areas, because we know how much health, education, social sectors are important to your drive for quality of life of River State.
Meanwhile, a healthcare revolution is taking place in Oyo State, going by the words of the governor, Seyi Makinde, who says that his administration will deliver 351 model primary healthcare centres at 1 per electoral ward in the state before the end of his tenure in 2023. Speaking in Saki, Oyo State, while commissioning the remodeled and renamed Infectious Diseases Centre, now the Saki Specialist Hospital, he hopes that this would complement existing health facilities at the time the world is grappling with the coronavirus pandemic.
To leverage on the situation and accelerate our plans to address the dilapidating healthcare infrastructure in Oyo State. We've invested close to ₦500 million on this facility, and for equipment alone, we've invested over ₦250 million. When we started work on the conversion and upgrade of this facility, it was initially intended to be an observatory, isolation, and treatment center to support our efforts towards fighting COVID-19 pandemic. But we also had more long-term goals to ensure that it fits into our overall plan to improve the healthcare system in the nooks and crannies of Oyo State.
Now, Israel's cabinet is to consider whether to impose a nationwide lockdown as the country struggles to halt a steep rise in coronavirus infections. The health ministry reported 3,904 new cases on Wednesday, a new daily record that brought the total figures to 142,582. The death toll also rose by 11 to 1,054. A week of overnight curfews, school closures began on Tuesday in 40 red areas with the highest infection rates, but health officials are reportedly now recommending a month lockdown. Here's the global update.
British Prime Minister Boris Johnson has announced a moonshot plan for COVID-free passports that would allow people who test negative to return to normal life. The plan involves mass testing, with results returned within about 20 minutes. A negative result allowing entry to venues such as theatres and football stadiums, among others. However, medical experts have raised doubts about the plan, citing issues with laboratory capacity for current tests. Despite the fact that clinical trials have been suspended, drugs giant AstraZeneca says a COVID-19 vaccine could still be available by the end of this year or early next year.
If the vaccine works, we will know that in the next few months. The next question will be for how long? Are you protected for 3 months, which is useful but not very useful, of course? Are you protected for 12 months? Are you protected for 2 years or more? And this answer will only come as the trials continue. It will take time to give this final answer. Now, as to the first question, which is, does it protect people, at least for a period of time? We should know that before the end of the year.
The British company suspended late-stage trials this week after a participant in Britain reportedly suffered symptoms associated with transverse myelitis, a rare spinal inflammatory disorder. Meanwhile, United Nations Secretary-General Antonio Guterres has called for $35 billion more, including $15 billion in the next 3 months, for the World Health Organization's ACT Accelerator program to back vaccines, treatments and diagnostics against COVID-19. In other development, Indonesia's capital, Jakarta, is set to reinstate wide-scale social restrictions because of a rise in coronavirus infections and the governor warning of an emergency situation as hospitals fill up. The capital will reinstate restrictions similar to those imposed from April until June, when public transport was limited and dining in restaurants was forbidden. Working from offices will also be prohibited from next Monday. And over in Israel, the government is considering a nationwide lockdown as the country experiences a new daily record in new cases.
For further updates, take a look at our website. It's channelstv.com. It has the latest updates on the pandemic. All you need to do is log on and you can access all the stories in Nigeria, coming in also from across the world. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay safe.